Hi everyone. Tonight I'm talking about the environmental injustice, Flint water crisis that began around 2014. Just sharing up front that I actually was able to go to Flint in 2015 and meet with the mayor and just a lot of activists and advocates in the community that were working to help Flint citizens at the time. So this is just some photos I added from when I was there. I would attribute one of the main mistakes that led up to the Flint water crisis was Governor Rick Snyder choosing to appoint an emergency manager to oversee policy and what cuts the city were making. It was very evident that because Flint was in such a high price deficit, that the mayor or the appointed official and Governor Rick Snyder we're prioritizing cutting costs and not making decisions for the betterment of the people or the safety and public health safety of the people. And that was very clear. And it's very clear as well that key informants or just important elected and chosen and trusted officials were not making these decisions for the best interest of their community. So that was very concerning, and I think a huge piece of what led to this crisis. And just throughout the entire way, it seems to me that price and cutting costs was the main focus against even human lives and human safety. The water facility workers had warned officials that the water was not safe to drink and that it was not ready to be provided to the public, and these emails were ignored. And just throughout the way, scientists were dismissed and healthcare and environmentalists were dismissed, even though they had credibility and firsthand experience witnessing the before the effect, the unsafety and unsanitary state of the water, and then even afterwards when people were exposed, just denying in the complete attempts to cover up this huge crisis. If I was to give advice of just where to start or how this could have gone a lot better, I would just say the extreme need of making informed decisions, having the right people at the table, that being the water plant staff, and having specific protocols where they test and ensure the safety of the water. Having scientists involved that can, again, just ensure the safety of the water, the bacteria in the water, and other live chemicals and bacteria that can affect people's bodies and safety. And just lastly, not making choices for the only thought involved being to cut the cost. Having someone at the table, having people at the table that care about this community, that want to see this community thrive, and that just is so evidently not what happened in the case of Flint, Michigan. Some key informants that I identified that would have best helped serve this community when the Flint water crisis was first found out or realized that it was an issue within the community was identifying scientists that had specific qualifications in like disease control, exposure to certain live bacteria that exist in water, and just people that are able to assess what this impact would have short-term and long-term on the community members that were exposed to this water. Again, listening to healthcare professionals, seeing what they are witnessing firsthand in the hospitals in Flint, and the effects this water that likely has come from water exposure that these healthcare professionals are noticing. Having elected officials making some decisions in Flint, trusted elected officials, would be a huge piece of regaining some trust in Flint for just government officials and just feeling like they're actually being represented. I would identify the mayor of Flint. if they were an elected official, the mayor representing the people and their general needs and what they are voicing to the mayor as what's coming out as a need for them as this water crisis and exposure to lead and other bacteria have been exposed to them. And I also put people on the ground meeting with Flint citizens daily. Just when I was there, a lot of like churches and aid groups were there to hand out water, and you would just get so much firsthand knowledge from meeting with like dozens and dozens of people a day about what they're experiencing health wise, physically, access to water, access to other medical needs from exposure to this water. So, yeah, definitely people, perhaps the leader of an aid group that is just witnessing firsthand and gathering that firsthand data from the people who have experienced the water exposure.